ways, that's really unusual. A lot of folks are not as engaged and informed as Sam is about rural healthcare, the challenges, the opportunities we have. And it's just every time that it's just like you just read all of the books we've written, and I really appreciate that. You have to know that during the COVID crisis, Sam and his team have advocated for rural healthcare, some very important initiatives. For instance, in our setting, making Scotland County Hospital and organizations like ours eligible for the PPP program. And now the late news is that it looks like that won't be offset against expenses. That's getting into the weeds, but it's a really big deal. So one after another, thank you for listening. Thanks for being not just an ally, but a warrior for rural healthcare. Congressman Graves, take it away. Thank you so much.
Thank you. I'm just moving around the district and taking advantage of the August break to get out to every county in the district and just talk to folks and see folks. And obviously with the pandemic and everything going on, we're spending a lot of time talking to hospitals and healthcare providers and folks like that and see what's going on, how everything is, and how you're doing. So we've been traveling all over and got to do a lot of. It's good to get out. I got to tell you, it's good to get out and be moving around and just talk to folks. A couple things we're working on right now. Unfortunately, right now at least, the infrastructure bill isn't going anywhere. It passed out of the House. It was out of committee. It was at $500 billion. It went to Speaker Pelosi's office. It gained another $1 trillion while it was sitting there waiting to be brought to the floor. The Senate has said they aren't moving it at all. The good news is, we're our water resources bill. We are going to be able to move it, which is very important to us when it comes to the Missouri and Mississippi rivers and how we manage those rivers. We will be able to get that done before the election. When we get back, we are going to be talking about the fourth round of COVID and flushing up the CARES Act and a lot of the money which is being used for organizations just like yours. And PPP, Paycheck Protection Program, and small business programs. We're going to be talking about flushing those up. Negotiations have stalled. That's probably more as a result of the fact that it's very tough to do negotiations over Zoom calls. And it'll be face to face is where we'll finalize that. We've got about 3 things we're coming down to. One is price tag. Speaker Pelosi wants $2 trillion. Leader McConnell wants $1 trillion. The second one would be liability protection for businesses and schools that open, and we want to be able to protect them from lawsuits. And then the third thing is obviously the extension of unemployment benefits. So we'll be getting back on that, and I look for us to have a package somewhere before the October break. We'll be back in September, the majority of September. We'll break again in October for the election recess, and then come back again immediately in November and get a lot of work done. So appreciate it very much.
I'd like to introduce you. This is a collaboration. This clinic is new, just started in June. I wanted to introduce you and acquaint you with some of the dignitaries here. This is a collaboration with our friends from Quincy at the Blessing Health System. They have been very active in Northeast Missouri healthcare with the Cahokia Clinic, the Hannibal Clinic, and now in collaboration with Scotland County Hospital. So we have Maureen Kahn, who's the president of the Blessing Health System at Blessing Hospital. Patrick Gerbler, who is the CFO. Kurt Ebers, who is really the mover and shaker and the shepherd of this clinic, because he knows all the ins and outs of the complicated Missouri regulatory system. He's got that all going. And then Jeff Davis is our CMO. He is the medical director of the clinic. Lori Nelson is the clinic manager. And you don't have to be sick, but we'll give you a tour today, and we promise we won't swab you. But Tabitha Rohr and her staff, LaDonna and Shannon, are there, and I'd like to have you meet them. In addition, the chair of our board, Lori Folk, is there. So Graves has been a real friend. She knows your name because we talk about you every time. And it's all favorable, all favorable. Lori Moose-Claire is the Knox County Public Health Agency head there. She does a fabulous job. There's been a little surge here in the area recently, and it's been handled marvelously. So you'd be proud of the team. So again, thank you for your support. We'd invite you to take a quick tour.
I want to tour it. Just to give you a real quick personal update too. You mentioned being swabbed. I've been swabbed so many times. The top of my head tonight. They shoved that thing up there so far. We did my family took advantage of the free antibody test at the Fairfax Hospital. As a result of taking the test, and then we had to take it again because everybody turned out, at least half the people in my family now, they found out, long story short, had COVID. So as a result of that, the family that we had, my extended family, all my brothers, sisters, nieces, nephews, husbands, wives, fiancés, in Platte County and Buchanan County, in addition to Atchison and Nottoway, we all had to go in and take the test and also get tested for COVID. Well, as it turns out, half of our families had it. We didn't know it. And we got double tested because of false positives. So everybody got double tested, as it turns out. Well, so my daughter and her husband and all three of their kids, they had it, and my sister and her daughter. Now, what's interesting is her other daughter didn't get it, but her husband got it, and that never transferred it. My brother didn't get it, but his wife had it. And it's bizarre.
It's a strange.
It's just a bizarre, infectious, process, and so we were, it kind of toward us.
Yeah.
We had no idea.
Does surprise you.
But
Well, we just got granted a part of the rural money that's gone through the counties, then for distribution. Scotland County Commissioners just accepted a proposal from our hospital to do, for anyone who wants it in the county, to do free testing. And we hope to offer that to Knox County too. We have to talk to your commissioners as well. That's another bit of funding that's really going to make a difference and help us understand more about the disease.
listen, what a great facility.
Les and Kim Cardwell are the owners of this building, and we're one of the tenants, and Les and Kim are over there, and they've been instrumental in helping make this happen too, because Les also helped us reduce the cost on the building project as well. So it's been a collaboration, just like you like to see communities come together. It's been great.
Absolutely.
Yeah. Shall we take a quick
Yes,
tour?
let's do it.
Tabitha, why don't you lead the way? Go ahead, please.
Funded it, and so we had to, of course, we had these dividers. Yeah, we try to get our patients back as soon as possible, but yeah, it's so beautiful here.
How many patients are you approximately seeing a day?
Well, we just opened in, it's been 3 months, so I would say, what are we at now? 15-ish, 12 to 15, yeah, we're still building up. I'm here 4 days a week. There's another provider here once a week, and then there's Dr. Davis, who's the medical director, who's also here too.
Okay. So you're
Yeah.
fresh, brand new.
Our clinic is fresh, just brand new. Yeah, so it's pretty fun. I mean, like getting to know the community and being able to offer services at home.
Tabitha's from Kirksville, is where she lives. Her husband and family live in Kirksville,
Yeah.
so she drives over here.
So I worked in Lancaster for 3 years, and then decided to come over here. Was offered the opportunity to come over here to open a new clinic. So it's been great, yeah.
You know, the nursing home is right next door here. The
Yeah, that's
County
gotta
nursing
be a
home.
big plus for them.
Yeah, I'm the medical director there as well, and have about half of the residents that are there, and so this works out to where, of course, right now we're doing a lot of virtual visits in nursing homes rather than bringing our staff in to do rounds or whatever. But she's been able to be here in case a resident needs something, outside of our monthly rounds that we do. So
Yeah, and then the school's just right across the street,
yeah,
which is so awesome.
So school back in?
Yeah.
they are. Yeah, they're doing face to face here. They probably offer online too.
Last I checked at the last school board meeting we had 18 students that were doing stay at
Virtual,
home,
right.
and that's probably not a good number right now. And so
Yeah. Scotland County is back face to face. Clark County is face to face. So most of the schools were back in session.
You wanna come on back in? Here's where all the magic happens. Pregnancy world right here, nursing area. And then, we have 5 patient rooms. So, yeah, and then, we offer all kinds of services. Well, okay, so there's Dr. Davis. Now, we're trying to bring in some, like, psychiatry, and then OB, that will come like once a week or something like that, as soon as, numbers start to pick up, so that we can offer those they've done a great job. Yeah. And then here's our break room back here.
How much changes did you have to do to build?
Complete
you know,
redo.
What's
This
that?
whole
It
corner
was
is
like down the
completely
studs, yeah.
redone.
It was
Yeah.
all the way, yeah. And they did a marvelous job. We love it here. It's beautiful.
Great.
Yeah.
Well, this is awesome for access. I mean, that's obviously in rural areas. This is a problem that we have.
Right. And we're getting them from, what direction is this?
East.
East, that's right. So they're coming from each direction here because schools all go, kids go to school here. And stuff, so.
Consolidated school district.
Yeah.
It's the only school in Knox County. This is the only school in Knox County. So every child comes into the school.
Yeah.
This is awesome.
Well, and there's a nursing home right there. I mean, literally, they just come in this door. Or Dr. Davis
He was over there.
can go over there.
Over there.
Yeah, so it's been so great. And there was another clinic that shut down before this, and so they were down a clinic in this area. And so the one got overloaded, so they weren't getting access, and so now people are coming back to get care here in town.
Great.
Yeah. So awesome.
Thank you.
Yeah.
Let me see. Thanks for.
They're telling us that you can go ahead and do your press interview. If you want to do any type of an interview, I know that the radio station wants to do an interview with the congressman.
Do you want to just do them together?
It's up to you. What are you gonna do?
Are you doing questions? People
sure.
talking to people?
Nice to meet you.
Where should we?
Thank you.
Yeah.
Absolutely.
Where should we do that at?
Wherever you want. What's a good? You just give me a good backdrop.
Let's go out into the lobby area.
Or the I form in the background with
We can do it outside too.
Yeah, it's kind of stuffy in here. Let's go outside.
Okay, all right.
Lots of people, or you know.
Good. Bye-bye.
All right. Thank you.
It is very, this is a wonderful clinic, and
This is nice. I don't know.
it truly is, and, you know, rural America is something that I don't always think of as a good person when all these circumstances, when they think about healthcare and what's going on, and, you know, it is, and we still need broadband in some parts of our region, you know, especially.
If there's one good thing that comes out of all of this, it's going to be that broadband deployment.
That's what we're hoping for because of all the schools and with the Zooming and.
We're going to do it much like we did telephone service out in the very far reaches. You know, we'll do it through Universal Service Fund. And,
Yes, thank you, and you know, it's just been great to see the action that you guys have done for us. So, we know Washington's been tough on you.
We're gonna come back in.
outside.
Where do you want? Yeah, outside's good.
We'll be right back in, Greg.
Oh, okay.
You're okay. If we can tuck ourselves into kind of a corner that's windy, maybe over here. Is this? It's good to see you. I haven't seen you in a long time. Yeah, this looks good.
How many? Do you know how many residents are in the nursing home?
I think they're licensed for 40-ish.
They had any problems over there?
No,
Okay.
but they have shut down to all visitors at any.
And that's hard too on the residents, but I understand.
Well, here, let's come over here for a minute.
I mean, it's just because so many of them are lonely anyway.
Yeah.
Without a spouse.
So right there, that, and I'll even zoom in, that porch patio area,
Yeah.
brand new. And when they were doing visits where you could do on the patio and could be separated and all of that. They did some like window type visits, and then we took a spike in numbers, and so all of that has shut down, kind of like it was shut down at the very beginning. But that patio has been amazing because, you know, they get out, they get the sunshine, they're growing plants out there.
It's hard on seniors, I'll tell you, though, to be lonely.
Move a little. Okay, Sam. Let's talk about everything. Can we talk about everything? Sure. Okay. Can we just do a hot wash on what's going on with rural broadband?
Mm-hmm. Yeah, actually, if there's one good thing that's going to come out of all of the pandemic and the issues associated with it is we have, you know, found that really we're truly lacking in when it comes to the rural areas, when it comes to broadband. We found that as a result of schools trying to do distance learning, when it comes to healthcare and doing that over the internet. Just so many things, people trying to run their businesses. So what we're looking at doing, and we're already starting to plus some of that up, and that's actually under the jurisdiction of the Ag Committee, believe it or not, is rural broadband.
Oh,
and
wow.
We're starting to plus that up. But now we're looking at doing more of a larger deployment, kind of like using the Universal Service Fund like we did when we brought telephones out to the rural areas. You know, the most expensive part is that last mile, and particularly to houses or homes that are, you know, way out in the country. And so we're looking at using a Universal Service Fund, which is basically everybody pays into it, and then they're able to draw from that fund to be able to provide those areas that just simply don't have it in the very remote parts.
I feel like because you're in DC, you get a look at us from like a totally different perspective. Like, what are some of the challenges that you are coming up with that we're having that we might not necessarily see, kind of being right here in the middle of?
The biggest thing is what I see, and you know, being from Tarkio, I'm from the same area, same type of background, everything, and it's an agriculture district. But what I have found more than anything else is there's so many people out in the country that don't understand what rural America is about. It doesn't matter if you're from Nebraska or Kansas or Iowa, Missouri, wherever. They just don't understand that we have trouble. You take healthcare; it's a perfect example. It's access, and in many cases, you have people that have to travel an hour to see their doctor. You know, let alone if it's an emergency or something like that. So we're very dependent on these things, just like broadband, just like the internet, or aerial evacuation. You know, in the case of emergency, whatever the case may be, these are very important things to us, and a lot of folks don't understand that. They think that, you know, we have the same access to services as they do in you know, New York City or Los Angeles.
Not the case.
No, it's absolutely not the case.
So as far as you know, what type of things can, you know, that you're doing in DC are having an effect that I'll experience here in little Edina, Missouri?
So, and that's a great question, and it's just like when we were talking about broadband, trying to figure out how we get it deployed to the smaller companies that are trying to provide it, but they just simply can't provide it to the very far reaches of a county. And so that's the reason we're coming up with this idea of doing a you know, Universal Service Fund, and it's nothing new. It's what we used when we electrified America and got electricity out to the far reaches. Then we did it for telephone service, and now we're looking at doing it for broadband, and so in high-speed internet. So it's just adapting some ideas that have been around for a while, but it's making good use of them today for new technology.
How long is this going to take for us
It's going to take a while, but the good news is we're seeing those grants are already going out. You know, Green Hills over in the northeast part of the state, right here, it got a great grant, a big grant as a matter of fact, to do some more rural broadband throughout their service area. So we're already seeing that money out there, and a lot of this is being deployed as we speak. But to get to every single household, it will take a while. There's no doubt about it. You know, but it's just like when we brought electricity everywhere, it took a while.
What about, let's jump into COVID testing. I just have my personal knowledge base. It's fairly difficult to get tested in rural communities. And, you know, in like a difference where you are, I don't know how often are you getting tested?
Well, that depends, because I get tested here and I get tested sometimes in DC, and I've been tested 4 times now. But it does depend on the area. Now the governor's deployed a lot of testing sites throughout the state. Now it gets back to, again, that access situation and how far you have to go to a testing site. You know, in my particular county, I'm only 7 miles away from from the local hospital, and that's where they do the testing. But I know people at the far edge of my county, you know, that's it's a 40-mile drive to get to the hospital to be able to be tested, and so it does make it tough, and that's just that much more inconvenience, you know, when you got to go that far. It takes more out of your day to be able to do it. But there's testing sites out there, not as widespread as I would like to see, but you know, that's part of the problem though, is you got to find a clinic or you got to find a hospital that can provide it.
I think it's interesting. Dr. Tolber said they're going to start testing, like Scotland County residents. Anyone who wants to test can do it for free. Hopefully, we can get something like that here in Knox.
That's great news.
And then just one more. I just want to shift gears completely and jump into Missouri's medicinal marijuana, which is, you know, dispensaries are getting ready to start opening here in the state. We've got a new fledgling business community. What are you doing in DC to help ensure that our new businesses in this medicinal marijuana industry can do things like bank?
Yeah, and that's a tough issue, to be honest with you, because right now with the banking regulations going on, and you got to remember something, we still have a federal law that state law is in conflict with federal law, and it's still illegal at the federal level, so that changes all the banking rules, and they can't use traditional banking. And I know it's something that the banking committee is taking a look at for states that have allowed for medicinal marijuana use, and being able to allow those businesses at least to function like normal businesses, not have to carry cash, you know, around, which can be very dangerous, to say the least. So I know the banking committee is working on that. I can't tell you where they are in that process or what they've come up with, but I know it's one of the big topics that they're working on.
Are you or is your office doing anything in as far as exploratory in kind of the medicinal marijuana world now that Missouri is really kind of full steam into?
Not really, because it's mostly, you know, that's a state function, and it's state law now, so you know, it's pretty much going to stay within, you know, state law.
So on the federal level, you're not really interested in?
No, that's not it. It's just the only thing that the federal level touches would be the banking regulations
And criminal.
So, and what?
Criminal.
Yeah, the criminal, but having said that, though, I don't know if you'll ever get that federal government to change that. I don't know. That's going to take a long, hard process to be able to change, you know, the criminal offense. It may turn into some sort of, or they may raise the threshold on the amount to still be a misdemeanor or something like that. I'm not sure. But medicinal marijuana is a little different too than recreational marijuana. Medicinal marijuana now is obviously prescribed or supposed to be prescribed, and that changes things a little bit too, and that may be where we have to tweak the law.
Sam, thank you.
Thank you.
Yes,
Absolutely.
okay.
Just a couple of quick things. I'm Mark Denny with
Yep,
KMEM up
absolutely.
in Memphis. You got a tour of a nice facility here. What are your thoughts and impressions on that?
These things are awesome. Whenever they come into a community, it's access, and in the rural areas, that's what we have a problem with. It's just access to good health care and being able to get to it either quickly, because in most cases, you know, at least in the rural areas, we have an emergency situation. You know, it's not so bad if you got a checkup and you know, you can drive an hour, but if you've got an emergency and you need help right away before you can get to a trauma center, things like this are you know, a nice you know, help when it comes to dealing with that. And then the access is just like with the nursing home over here, or you know, just the community itself. They need facilities like this, and medical personnel need a facility to be able to operate.
And then go back and talk a little bit about the technology that you mentioned earlier too, that you know, the broadband situation that we have here. It's going to take a while to get some of that here, but
It's happening.
the emergency is now. So if that's going to be a ways down the road, then how do we go about dealing with it on a local level at this time?
It's happening, and it's happening now, and they're looking at it. And I know some of our local companies are actually, you take like Rockport Telephone or Green Hills, the small companies are actually taking the lead much better than the big behemoths, you know, like Southwest or AT&T, you know, whatever the case may be. They're looking at how quickly they can get something out there, and they're maybe even extending themselves or borrowing the money to be able to deploy that even quicker, and then hoping that it gets back from some of these funds that we've been talking about.
So in the meantime, what's the word from Washington right now? Are more shutdowns looming on the horizon, or are things going to start getting more back to normal
I
in
think
time?
they'll start getting more back to normal, and I applaud the governor for opening up our state. And I think what you will see is You know, obviously the states are taking much more of a leadership role when it comes to that. Missouri's now open. I think that's a very good move, and I hope to see the rest of the country do the same.
All right. Thank you very much.
Hey,
Appreciate your
Congressman,
time.
we have some economic development folks,
Yeah.
the Morning Pump Office of Blessings, we got David King, got a meeting here. One more time. We're gonna go ahead and go in that room.
I tried to do it.
Follow you.
Where do you have the hospital people?
Yep. Yeah.
Is Lori still here? Just follow you.
So we can spread out just a little bit. There we go. All right. Very good. Let me get the rest of everybody in here. Yes, American Family Service.
The license office, family service has an office here. Oh, and, American Title and Access office as well.
I'm surprised you didn't have this is a bad one.
Let me out of the way. Sorry.
McKenna. What was this building before?
Was the Northeast Missouri Respect Funds, the old Jim Sears, used to be called the Jim Sears building there. Jim Sears.
He was a state rep. I don't remember him, his name.
Just didn't work, and so a few years ago, they put it up to sell it. And Kim and I bought the thing for the community, we joke about, we didn't want to see cardboard recycling or something here next to our school or nursing home. And purchased the building and wanted to see something for the community go in here. And it worked out with the clinic, we kept the license bureau here, we kept the state of Missouri, family services here, they'd already received it. They'd already gotten the eviction notices that it was gonna sell.
Yeah.
And so we were able to keep them here and keep something for the community in the building.
Great.
So when the clinic came along, it fit right down the plan with what we were trying to do for economics and jobs and the whole thing.
When did the old clinic close?
Well, Northeast Regional had a clinic here, and they probably haven't been open for what, 3 years?
3 years.
It was January, it was December 31st of 19.
18, so 2 years.
Second year is in December.
And then the Health Council, the Northeast Missouri Health Council, which is a FQHC, still has a clinic here with just a nurse practitioner as well. And they're based out of Kirksville.
Do you think there's any chance when going into the COVID crisis, we were among the 50-ish% of hospitals that were vulnerable, because of financial frankly, underpayment by Medicare and Medicaid. It just doesn't pay your expenses. Do you think there's a chance that, realizing it was sort of like, I liken the situation to taking someone that has congestive heart failure and putting them on a treadmill? They're not gonna do real well. Is there any chance of revisiting the funding streams or the regulatory environment to try to make it a long-term run for rural healthcare?
There is, I mean, it's up in the air whether or not we're gonna be able to get that done. Obviously, those who represent rural hospitals and critical access hospitals, pushing pretty hard to get, and that's all, reimbursement's always been an issue with small hospitals. It just always has, and it isn't getting any better. And so we're trying to take advantage of this opportunity to push to get that fixed. There's talk of being able to do it in this fourth COVID package, doing something a little more permanent, let me say that.
Yeah.
So, and again, what I mentioned outside was we're gonna start those negotiations again. I think we will get something passed. I don't know what the money amount is going to be, but I'm optimistically hopeful.
And I think we've had the conversation before that it doesn't cost the government anything to regulate us. We spend a tremendous amount of money for the level of care we give, which is a basic level. I think we all agree, not trying to be anarchists, we don't want to be regulated, but just like, we spend a lot of money on compliance, it leaves us scratching our heads sometimes, and that doesn't cost the government anything, but it would save us a lot. So I applaud the president's efforts to deregulate. I know that you're on that bandwagon too, and I would sure hope you could continue to support that.
Be particularly helpful for our rural access.
Sequestration is something that ended up affecting us, I mean, because our cost-based reimbursement for critical access hospital on the cost report, originally was supposed to be 99 cents on the dollar.
101 cents of allowed cost.
Yeah.
By the time you take away, they don't allow us to put on the cost report the cost of, reimbursing for some medical, some education expenses, phones in the room, gift shop, things that you have to compete. The current problem that's a real threat to us is this silly transparency thing. If you want to have a gallbladder in my place, I can tell you what it's going to cost. Just tell me what your insurance is, I can let you know. But yet we're being told that we have to spend lots of money and time and everything to expose to every private insurer what our negotiated discounts are. So if I have a really favorable contract with Blue Cross and not so favorable with Cigna, what do you think Cigna's gonna do when they see my Blue Cross contract, or vice versa? They're gonna cancel and say, hey, I want the same discount the other guys get. It's gonna be a race to the bottom, and that only compounds our problem. So it's not that we wanna be opaque about our pricing. We have people hired to specifically navigate financially for people. And I know the blessing system does that too. But complying with that is we attended a webinar the other day and everyone just looked at ourselves, how are we gonna get this done? Right? It's incredible. I don't know, I know there's some court challenges going on, but it's a tough road out.
And that was CMS.
Yeah.
Yeah.
Pretty egregious. You have to put, what is it, the top 100 things you do, a matrix of all the insurance companies, what you're being discounted, and you have to put it in lay terms, not just CPT codes, and you have to keep that current, so every time there's a change, you're gonna have to fix that.
Plus, we've signed non-disclosures with our insurance companies that have prohibited us from disclosing what we've negotiated. So you're almost violating
Contract.
well, you are violating your contract.
You'll be out of CMS compliance, or you'll violate the contract.
I commented to Josh Hawley's assistant when we were up there last time, because Josh couldn't make it until early. I said, well, I think I'm on board with transparency. I think our communities would be interested in seeing what the markup is on the GECT that we're having to put in, or the bag of fluids that cost us $125. I wonder what it costs us to manufacture that in Puerto Rico. If that was made transparent to the communities, you talk about an uproar. I'll play the game, but let's have the fair rules for everyone. That's something that maybe we could think about, that everyone as a supplier to hospitals need to be transparent with their charging and what their wholesalers are charging them, what their discounts are.
Well, I think a lot of us, what was it, who was it asking us to give our pharmaceutical information.
Yeah, for the 340B, yeah, Merck.
And Pfizer, like
Mark wanted us to disclose private health information.
Yeah.
On 340B
Sample.
program. Well, I hope you can preserve that, that's a lifeline.
Yeah,
340B.
340B is critical for, 340B, yeah, it's critical to get those drug costs and lower amounts, especially for the small ones.
Yeah.
So how many cases are you seeing? What's your latest numbers?
Our rolling 7-day positive test rate is about 6.7%, I think, this morning.
I just got a text while we were here that there was one new in Knox and one new in Scotland that we tested today.
It's been as high as, what, 16%?
Yeah.
Right? How about yours, Maureen?
Ours, well, we've been double digit was our positivity. We got our hands slapped by our governor, and so we went into a big campaign the last 21 days of mask wearing and social distancing. So we are down under 4% right now as our positivity in our county, but I have 19 people in the hospital. And we're seeing it in younger people. So our admitted people in the hospital are anywhere between 40 and 70. And it's, you know, socializing, being out and having a good time. A lot of them go to the Lake of the Ozarks, and that is where everything started for us in our community. You know, they went down there, they had a good time. And then we had college kids passing a marijuana pipe around.
Oh.
And a vodka bottle, wanting to see what they could do at a graduation party. And there were about 50 kids. And what was interesting is they took it home to their parents. And it wasn't, you know, a few of the kids tested positive, but we saw their parents because they were touching different surfaces in their homes. And, you know, what you do in your own house, you may drink out of your parents' iced tea glass, or what do you do?
Did I see that it was in the elementary school?
Yeah, our kids are back in school, and we haven't had an outbreak in the school, but we're screening every one of our children as they go into school. And our kids are screening, and if they have any sign or symptom, they're sent home. And so our kids are being stopped, and a few of them are testing positive. And so we know that it's coming into their homes from an adult. Somebody else is bringing it into the home. But we haven't had an outbreak. We haven't had a child-to-child yet transfer in the classroom. But our classes are still going. Only 20% of our parents have kept their children out of the classroom. They had a choice of going back live or Zoom. And so only 20% of the public schools haven't sent their kids back. And our high school kids had to go back on an every other day schedule because they couldn't socially distance them well enough. Because we go down to one high school in our public schools. And the parochial schools are all back. Their enrollment is small enough full-time, both for grade and high school. And so far, so good. We haven't had any children admitted. The youngest person who was admitted to the hospital has been 19, and that one was in ICU. And we've been using the remdesivir, has been the biggest drug for us that we've used, and convalescent serum we've been using from Red Cross. And that seems to be effective if we can get it quickly into people. We have drive-in testing clinics, and we probably test, I'm gonna say, between 50 to 100 people a day. We're open 7 days a week. And on the Missouri side, we're probably testing 30 to 70 a day on the Illinois testings. And if there's a big party weekend, like for Memorial Day, we're expecting a lot more.
So here comes Labor Day. So.
Yeah, today we did a press conference this morning reminding them Labor Day's coming. You know, we know everybody wants to have fun. We don't want to be the party stoppers, but wear your mask,
Socially.
And as the school superintendent said, and kiss the right girl. And I'm going like, what's the right girl? You know, like, how do you tell?
One without the coffin.
But you know, if you listen to what you had to say today, you don't know who the right person is. Because in your family, nobody had symptoms.
Did they have high-risk contacts that you knew of? Or?
You know, at QU, we had, at Quincy University, 50 students, all of the students had to test before they could come back on campus. 50 students tested positive and they had no symptoms and they couldn't come on campus. And they were positive when they tested them, antibody-wise, as well as they were testing positive. And we know that these kids will test positive. You could test positive for up to 12 weeks post
Infection.
being sick with COVID. So we don't know when they might have been sick, but they had to stay out for 14 days before they could come on campus.
The only symptom that anybody in our family experienced was a loss of taste.
Yeah.
And it wasn't really a total loss of taste, it was just stuff tasted funny.
Isn't that something?
That's been
And that test is interesting, isn't it?
Yeah.
You want to say, I'm not having brain surgery done, or, you know, where do you think you're going?
the frontal lobotomy.
And then they do his second nostril. It's, you know, you think one is enough. Because I had to have dental procedure done, and the dentist wouldn't let me come without a COVID test. So I said, oh, okay, I'll go have this done. And I went, whoa. And they said, hold on, we're going down the other one. I'm going, whoa.
I had a nurse do one of my tests one time. I swear she was coal mining or something.
And you know, I said,
could feel in the back
can you
of my
imagine
head.
can you imagine a child sitting in a car? I'm figuring you've got to papoose them or something. I mean, because it brings like a little kind of like tear to your eye or something.
I had to go over to the White House. Before you can go over to the White House, you have to do the rapid test. And they do it right there on the spot. I had to go over there for a meeting. And yeah, it's instantaneous. It takes about 6 minutes.
Wow.
And I think saliva testing is gonna be soon.
Right. We talked to WashU, because Washington University they have it now, saliva. And I talked to them because we have a relationship with them. And I said, we'd love to have it. And they said, we're gonna expand up to you. It'll take a couple of months, but it is, they're excited about it. They've got some good reliability data. I haven't seen it.
And I think it's no reagents or whatever, like once you start doing, I think any lab is able to, do it as
Correct.
opposed to, having to put it in some type of a, thing and send it off, so it's
They
rapid.
even design their own little cups to catch it on the campus. I mean, it's amazing. They've got all this stuff going, so it'll be nice. But the governor was coming, and he said, the governor's gonna get ahead of you. I said, of course I know that. It's your state, you belong in that state. I'm over in Illinois.
Congressman, we have to hit the road here soon.
Okay. We got it real quick too. We got a briefing, the most recent briefing we got out there is they think the vaccine is gonna be ready, and y'all probably know more about it than I do, but the vaccine's gonna be ready by late fall. So it's not gonna be as late as we thought.
That's
Which is good news.
It sounds like there's a fairly big race for which one will be first. I mean, because, Novavax and Moderna, there's a bunch of them that got, in phase 3 that are coming all at the same time, so it'll be interesting to see which
Do they
one.
all have,
And that's capitalism.
Yeah, that's right, that's right.
So is it worked out to where they all have some kind of a contingency contract to where they've committed to be able to gear up to 50 million doses right away, whoever wins the race, or how's that going to work?
And I don't know how exactly it's gonna work either, when whoever cracks that nut first, if everybody else that jumps on and starts producing that under contract, or if they can continue to
Take theirs,
to
advance
take
their
theirs
own.
even farther, because I think they're actually pushing for that, to be able to take it on farther, just in case there's a problem with, with whoever's vaccine gets
Right.
And you've probably seen too, there's one, I think the one that Oxford is developing is a T-cell mediated response as opposed to a traditional like antibody response, because they're uncertain about whether antibodies will give a long time protection or not, and I think the T-cell mediated might. So I think we'll end up seeing 3 or 4 kind of
different mechanisms of action.
Yeah, yep, and it'll play itself out. Capitalism will end up playing itself out. And I know China, I mean, has one that they say is very close, as well. I don't think there's any U.S. companies buying it, but, World Health Organization wanted U.S. government to participate with them in a vaccine thing, and the administration opted out, of doing that. So I think we'll have, one either from Moderna, AstraZeneca,
China has a whole different standard of
testing, exactly, right, yeah.
Congressman, once we have a vaccine, will it be mandatory that people take that?
Yeah, we got 30% of the population will refuse to take it. No, you can't mandate a vaccine. Yeah, that's been talked about too, at least in terms of the number of people, because it's expected 30% of the population now will take any vaccine.
Yeah.
That's right.
It'll be, I think it'll end up being interesting whether individuals or businesses, companies, restaurant chains, whatever, will want people to show some type of proof of vaccination, and whether that'll be a liberty violation, or not. It'll be interesting to see how that all plays out, I think.
We've talked about having as a policy that if our employees wouldn't take the vaccine, but then got the disease, that there may be either a higher copay or deductible, or, there's some.
Skin in the game.
Becomes responsibility, right?
Yeah.
And, so that's one way to look at it, where you're not forcing people, but you're incentivizing them to take it.
Thank you all.
Thank you.
Is the supply chain gonna come back here so that the next go around, whatever we face, will have masks and things made here rather than China?
Yeah, that's what the push is for.
I hope so.
Yeah, let's hope so too.
Yeah.
It was interesting to see all the companies that are springing up out of nowhere.
Making masks.
I think this might be it.
Where's it at still?
Thank you.
You just have an address, right?
Thank you.
Anniversary accommodation.
I'm Echo Menges for the Edina Sentinel and NemoNews.net. Thank you so much for watching this visit from Congressman Sam Graves here in Edina, Missouri. I'm going to go ahead and shut this live stream down for now. And again, thanks for watching.